I want to talk about a topic that's been very important to me for the past couple of years. I want to talk about community-based scientific monitoring approach called citizen science, which is emerging to be an important area of public health research, especially in the space of information science and technology. So to begin with, I want to shed light on what the problem is in the information science and technology and community informatics space. So the social, political, and environmental factors of a community can significantly impact the overall health and well-being of its residents. These factors play a very crucial role in determining the health outcomes, and they can contribute to health disparities within the community. For example, environmental injustices, such as disproportionate placement of hazardous waste facilities in marginalized communities, can lead to adverse health effects. So I have several examples listed here. And for example, the first one talks about the lead contamination in Flint, Michigan, which happened early in 2014. The government officials switched the city's water supply from Lake Huron to the more polluted Flint River. And the lead poisoning, the local water was contaminated, and the activists and local activists and parents' concerns over water pollution in their community was largely ignored. The lead poisoning severely affected the reproductive health of the community. Over the span of 7 years, fertility rates dropped by 12%, and fetal death rates increased by 58%. There was increased risk of hypertension among pregnant women, and there was increased risk to children being born with cognitive impairment, behavioral disorders, hearing problems, etc. While the condition in Flint, Michigan is under control right now, the public health threat is not yet over. There are still concerns over the levels of lead in the public drinking water system, and these levels are below federal action levels right now. So the public health disparities among marginalized groups are largely well known. And one popular solution to address this disparity that has come up in recent years is to mobilize communities and empower communities so that they can have the means and agency to drive change towards positive health outcomes. So for example, in the Flint, Michigan case that I just mentioned, the local residents, they took, if you read the newspapers, you'll see that the local residents, they took several steps to drive change, but unfortunately, they were not part of the narrative until the very end. Now, over the years, one popular research technique that has come up to ensure that citizens and communities are included in public health research is by using various kinds of crowdsourcing techniques. And a lot of us have heard about crowdsourcing techniques now. It has become a really popular topic in healthcare research, especially with the explosion of various types of personal wearable devices. And it's getting a lot of traction in healthcare research. It's a very good way to get large amounts of data from the public and also include the public as participants in healthcare research. However, the problem with crowdsourcing is that the participation is usually very passive, and it's not enough to meet the values of community science and citizen science, and it's not enough to empower communities. Adding to this crowdsourcing technique of public health research is a participatory technique of including public or community in scientific research. It adds to the crowdsourcing model by creating a technique where community is acting more than just human sensors. They are active collaborators in the scientific process, and they use data-driven and scientific techniques to monitor and take charge of their community's health. They become essentially community scientists or citizen scientists. So citizen science is the term which is commonly used to describe this phenomena that I talked about. It's a phenomena where citizens of a community monitor and manage their community's health and resources using data-driven approaches. Citizen science may sound like this new phenomena, but it's not really a new thing. Humans have been, curious about their natural environment for centuries, and for centuries they have been collecting data in the form of observations, and they've been making sense of those observations to understand the natural environment around them. Professionalization of science excluded the knowledge of these like so-called amateur scientists. And the concept of citizen science aims to bring back the knowledge of these amateur scientists by providing them a pathway to participate in scientific research. So citizen scientists are, mostly volunteers, and they can participate in scientific research in a lot of different ways. They can help with data collection. They can participate in data analysis process. They can even work with professional scientists in designing the research study. Citizen science offers benefits both to professional science and communities. So for scientists, it helps in increasing spatial and temporal data collection and processing capabilities, which leads to increased knowledge production and more scientific publications. And on the community side, it strengthens communities, because when you have regular citizens who don't have a background in science, who are actively participating in scientific research, they are getting informal learning about data, about science, which in turn leads to a more stronger and a more engaged community. So to give you an example of what exactly citizen science is, this is a really good example of citizen science in public health. It's called Girl Trek. So it's essentially a civil rights inspired health movement encouraging African American women to adopt a daily habit of walking as a way to reclaim their neighborhoods. And these women, they're citizen scientists, and they used this app called Our Voice Discovery Tool mobile app, which was developed by researchers at Stanford. And what the citizen scientists, in this case, these Black women, what they did was they took more than 230 photographs of their neighborhood and then analyzed those photographs using this app to assess the neighborhood features that improve walkability. And as a direct consequence of the project, sidewalks were repaved, and the length of time for pedestrians to cross the road at crosswalk was increased from 20 to 40 seconds. While Girl Trek is a really good example of citizen science in public health, if you actually go and search and read examples of citizen science in public health, you will come across a lot of different kinds of projects with a lot of diverse participation styles. For example, projects like 23andMe, which a lot of people have probably heard about here, they use self-selected participants that contribute data or samples to this large-scale genomic initiative. And while, projects like 23andMe are great for providing more personalized healthcare, I would say they lie more closer to the spectrum of crowdsourcing and not citizen science. And there's nothing wrong with crowdsourcing, but the participatory citizen science model that I described with the example of Girl Trek earlier, That's something that is still very difficult to achieve in the healthcare space, and that's why you don't see a lot of those examples in scientific publications. And one of the reasons, the main reason, is due to ethical concerns with respect to data and privacy. So research policy, which is grounded in human subject research, aims to protect the rights of the subjects from unnecessary risks and harms. It's also the informed consent is also about making sure that the person being studied has control over, they have control over their choices and interests, and even if those conflict with those of the researchers. And there's a lot of debate right now in citizen science is whether these rules and principles used in traditional research can be applied when patients or participants have a big say in deciding how the research is done. And that is a reason a lot of projects, right now are closer into the spectrum of crowdsourcing. And they're still termed as citizen science, but they don't really follow all the values of citizen science. But nevertheless, I still think citizen science is, has a lot of positive outcomes, and it gives patients and participants more control in medicine and research. And when people actively take part in research and have a say in the decisions and plans, they're exercising their autonomy in direct ways. So now I want to talk a little bit about technology interventions and how that facilitates citizen science and public health. As I said earlier in my presentation, citizen science is an emerging area of research in information science and technology domain. Therefore, it is important to consider how design of technologies can be a barrier or facilitator of health equity and participation in citizen science projects. The design of digital systems and interfaces and the decisions that we make in implementing different features into the system can affect how we make science more accessible to the public and how we achieve the goals of democratizing science and providing citizens with means to have agency and say in the research and decisions related to public health. One important lesson that I have learned with my research is that in order to develop successful citizen science projects where we can successfully achieve these goals and values of citizen science, we need to focus on small communities or smaller sections of communities or smaller neighborhoods rather than large populations. By focusing on smaller sections of the communities, we can create better strategies for encouraging and retaining volunteers. Finally, as a human-centered designer and researcher, I want to reflect on some of the lessons that I have learned with respect to designing technologies for citizen science. Here I have listed some of the key design decisions that technology developers should consider for successful public participation in public health research and decision making. So to start with, citizen science platforms should encourage volunteers to discover which aspects of their surrounding environment have an impact on healthy living. These platforms should provide easy and accessible ways to capture and report data to professionals. Platforms should have collaborative features to allow citizen scientists to easily collaborate with both professionals and other citizen scientists, and also collaboratively be able to analyze and interpret data. The collaborative features were very important, and they should also provide a social networking environment for volunteers to discuss and pose questions. And finally, the platforms should support actionability. All the research done by volunteers should be easily be able to communicate it to decision makers to take action on the reported findings. So I guess my final message with this research is that the state of healthcare is changing rapidly, with services becoming more and more personalized. And in tangent to this personalization, a personalized healthcare approach, I think it is very crucial to focus on bridging the health disparity by giving people, especially those in marginalized communities, the right tools to have the right knowledge and agency to influence the health of their communities. Thank you.